Hello everyone, I'm Dr. Girish Nair. I'm the lead consultant neurologist at Apollo Hospitals, Navi, Mumbai. I have an experience of over 13 years now in neurology. Today I'm super excited to talk to you about epilepsy. What exactly is epilepsy? Epilepsy is a disorder where there is episodic neurological dysfunction, and this is correlated with episodes of electrical imbalance in the brain at a very simple level. Now, there are several misconceptions about epilepsy. I want to discuss some of the important things that we can do to understand epilepsy better and have a better response in case someone around us either has an epileptic seizure or is diagnosed with epilepsy and is on medication. So epilepsy is fairly common. There are certain vulnerable groups in any part of the world, and women with epilepsy are a vulnerable group. And there are a lot of misconceptions, and often a diagnosis of epilepsy is treated with stigma. The good news today is that with the kind of advances we're making with research, we have very effective medications that can control epilepsy extremely well. And the vast majority of patients with epilepsy have epilepsy which is very, very well controlled. It does not interfere with their ability to lead a normal life. There are a few precautions that might need to be observed in the initial days of the diagnosis for the first 6 months typically. But once a condition is under control, there are no restrictions with respect to driving, other activities, living by oneself, traveling overseas for career opportunities, or in terms of starting a family, because the genetic risk for epilepsy is extremely low. People with epilepsy need to be treated equally, with empathy, with understanding. There should not be a stigma around epilepsy. So the important message that should go out to our people is that epilepsy is just a condition like bronchial asthma, allergies, high blood pressure, or diabetes. It requires regular treatment, it requires follow-up, but it does not compromise the quality of life in the vast majority of people who have a diagnosis of epilepsy. If a person you know or you yourself suffer from episodes that seem completely weird or inexplicable, there is a strong possibility that you're dealing with a type of epilepsy. Do not ignore these symptoms. Very often it is seen that patients delay approaching a specialist and having the correct diagnosis and treatment made because they have either not understood these symptoms or because they believe that they have a problem that no one can solve. So if there is an area that escapes your understanding, do remember to get in touch with a neurologist. Very likely he or she will be able to solve your problem. So on occasion of World Epilepsy Day, let's have this attitude of understanding, of destigmatizing, and reaching out to people who need our help, our support, and understanding. And we don't look at these individuals as patients. We look at them as persons. And epilepsy is just one another thing, like a mole on the nose or a scar on the hand. It's just that. It's not a big deal.